It's free. It's already been adopted by a New York health system. Correct, doctor?
That's correct. We have been working with Mount Sinai since last Sunday for the general public and already did over 100,000 vaccine bookings, at peak rates of over 100 vaccine bookings per minute.
We needed to just drill down on exactly what we're talking about here, because the process itself is exactly what you'd expect. You'd want to be able to go online or on phone, set up an appointment that is available for you, make sure that you pass the screening test, that you're eligible, and then also maybe set up the subsequent one, since it's a 2-dose vaccination. None of these things seem like you need to reinvent the wheel. It just seems like the amount of demand right now is outstripping the ability for anyone to do it. Does Zocdoc somehow get around that problem?
Look, scheduling is one of these things that look deceptively simple, but turn out to be quite complicated. And as it turns out, Zocdoc has been, unknown even to ourselves, been preparing for this moment for the last 13 years. The core of what we do is we simplify the healthcare logistics so that the doctors can focus on caring for patients. And so, we have a solution that works at scale, that can be implemented very quickly, and that's obviously completely free, and it's our contribution to the public health effort.
In New Jersey, the different counties have websites where you can go, but I was trying earlier to get on one of those things, and twice I gave all the information, but then it ended up there were no available appointments, so there's no reason to do it. And then when I hit submit, it just sat there. I think it was down. I think that it crashes the minute anyone tries to use it. What, yours doesn't crash because of the scale you built into it?
It doesn't crash. We've been doing this at scale for nearly a decade at this point. And what I'll say is, see, this is what you're describing is some of the user experience elements of getting this right? Asking you to fill in a lot of information prior to knowing whether there's even availability is already one of these big learnings. And how you get a booking appointment to under 30 seconds, which is what it typically takes on Zocdoc. That is part of the art, making it easy for even elderly patients to use this. I think we are really in 2021, there's no reason for them to wait in lines or wait for websites to load or fill out many items just to learn they need to look somewhere else.
Shepard Smith here. Thanks for watching CNBC on YouTube.